Hi, so in today's video, we're talking all about how to answer follow-up questions. So here's one of the things, follow-up questions, they're going to come up a lot more when we're looking at the next generation NCLEX. And the reason why you're going to see it more often is because follow-up questions, they help to determine how will you truly understand what is imminent, what is worsening, which is honestly all about patient safety. So in this video, I'm going to go over with you how to answer follow-up questions. So stay tuned for more. Okay, so let's talk about follow-up questions. And if you want more help, you can always click the link below to download some of our free resources to further help you. So here's one of the things when it comes to answering follow-up questions. The follow-up question is really about seeing if you can identify what's wrong in the picture. And then in addition to that, what should you do appropriately or correctly? So there's I would say two main things that is centered around follow-up questions. One, that you understand what is the complications that can occur with a specific disease process and or procedure, right? So for example, a potential complication with hyperthyroidism is thyrotoxicosis. That's when they're really it's really, really severe. And then a complication with hypothyroidism, hypo with the O, thyroidism, is myxedema coma. That's a complication that can occur. A complication with heart failure that can occur is cardiogenic shock. These are all examples of complications that can potentially occur with a disease process. The key, though, is to recognizing the signs and symptoms that's indicating that it is even occurring. Okay? That's the biggest thing, is that so when you are studying, one of the things that you should be studying is you should be comparing the disease process and also complications with that disease. So that way you can train your mind to be able to recognize it on the test and recognize the signs and symptoms. That's probably one of the biggest things I'm going to tell you. The other thing now is, and this is important because when you are taking the test, and when it comes to nursing, a lot of times it's not going to tell you, oh, the patient is now in cardiogenic shock, or oh, the patient is now crashing, right? It's not going to say that. Instead, it's telling you the signs and symptoms that indicates they're having that issue. And so now you have to be able to recognize that, and you have to be able to prepare for what to do, right? So one of the problems I see for a lot of students that struggle to pass the test is that they're not aware of the complications. They're so aware of the signs and symptoms of CHF, the signs and symptoms of high blood pressure, but they don't know what's the next thing that can happen that would show the patient's getting worse. So I hope what I'm saying is making sense, but that's one of the biggest things. The other thing is that you got to know the side effects as well of medications. That's huge on the test, is being able to recognize the potential side effects that can and will occur with certain medications. You should memorize at least two side effects. One of them is a side effect, another one is an adverse effect. Side effects are things that can occur that's not necessarily dangerous, but an adverse effect is dangerous and would result in the patient crashing or mortality risk being very high. So you have to be aware of that. And you have to know, okay, for example, let's say you have the patients on a beta blocker, okay? And let's say now the patient on the beta blocker, and the scenario it's giving you is that it's telling you patient is now their respirations is now 10. They are very drowsy. They're slow to respond. They're kind of lethargic. Upon listening to their bowels, listen to their lung sounds is diminished. Which of the following would the nurse do next? Which of the following would the nurse do, or what would require follow-up? Or that could be positioned to a case scenario question. So in order for you to understand that, you have to know that a side effect of a beta blocker, especially mainly if they have some type of underlying respiratory disease, is respiratory depression. All right. So respiratory depression, I'm going to put it here. Okay. Respiratory depression is a side effect. So if you didn't memorize that ahead of time, you're not going to anticipate that this is abnormal for that drug. That's a huge thing on the test. So because here's the thing about these follow-up questions. When it comes to the exam, follow-up questions is all about patient safety, right? It's all about your awareness, your understanding, your realization of patient safety. And a lot of times people say, oh, patient safety, but you need to know specifically what patient safety looks like. And part of that is knowing the side effects of specific medications and knowing what are the signs and symptoms that indicates that they're having that side effect, right? And when we're looking at follow-up questions, they come in different types of formats. But many times that your focus is that you need to look for the statements that indicates that something is wrong, right? Something is very, very wrong with the patient. And so you have to be able to recognize what that is. Now, inside of our book, this is our pharmacology cheat sheet guide. I go over different type of medications, and inside the book, I do go over side effects and adverse effects. And there's also 100 questions at the back of the book that are all pharmacology questions. So this book will help you when it comes to pharmacology and knowing the side effects and the drugs. To get this book, you can always visit our website, choosenursing.net, or you can click the links below, and you should be able to see the links to access our physical books below. All right. So this is one of the things is that when it comes to these questions, really, really hone in on and pay attention to what is wrong. You can't know what is wrong though if you don't understand how the disease process really even works, right? If you don't recognize what the potential complications that can occur. So what did I tell our students in our school is I tell them on a piece of paper, if you could separate, okay, on one side is the diseases, another side is the complications. And that will teach you to train your mind to be more aware of complications and be able to recognize it when it comes to the test. All right. So I hope that what I shared today was helpful. I hope that you learned something new, and that you apply exactly what I told you so that you can be successful when it comes to your exam. If you need more help, like I mentioned, you can visit our website for more information. And then if you go ahead and if you haven't already, make sure that you go ahead and click the like, subscribe, and follow us. Make sure that you stay tuned so that way you can be aware when we start more information. And share this video as well with somebody that would benefit from this. All right, thank you for watching, and we'll see you the next time.